Good morning, and thank you for joining the Department of Medical Assistance Services Cardinal Care Managed Care Provider Live Question and Answer session. My name is Michelle Watts, and I will be your facilitator today. First, I want to extend a warm welcome and express my appreciation for your time as we navigate the upcoming Cardinal Care Managed Care CCMC implementation. We recognize the demands of your schedules and truly value your participation in today's session. During this discussion, we will provide a comprehensive overview of the Medicaid managed care contracts associated with CCMC, which will take effect on July 1st. Additionally, representatives from the health plans will introduce themselves and share key details about their programs. We also want to take a moment to acknowledge and thank our DMAS staff and managed care partners who are here today to assist in answering your questions. You will hear directly from each health plan during this session, and they will provide insight into their specific offerings. Next, we will move on to the CCMC Provider Enrollment Educational session, which delivers a deeper understanding of this transition. If you have any questions during the presentation, please submit them through the Q&A panel by clicking the Q&A icon, typing your question, and submitting it. DMAS staff will collect and organize these questions in preparation for the live Q&A session. As you submit your questions, please be mindful of any potential protected health information or PHI to ensure compliance with privacy regulations. After the Q&A, we will provide next steps and wrap up the session. At this time, we will proceed with the CCMC Provider Educational session.
Welcome to our Cardinal Care Virtual Education Provider session. We also want to take a moment to thank you for your time and for taking care of our Virginia Medicaid members. We appreciate you and the work you do. Cardinal Care is DMAS's program name that includes all Medicaid members served through managed care and our fee-for-service delivery systems. Our agenda for today, we are going to take a moment to go over some background and goals for Cardinal Care Managed Care. You also may hear the acronym CCMC. We're going to talk about what is staying the same and what is changing. We will provide an overview of the foster care specialty plan and of the model of care. Also some reminders and provider resources, and then our 5 health plans are going to provide presentations to you. A Virginia Medicaid overview. Most of the Commonwealth's Medicaid members who are eligible are enrolled in an MCO or managed care organization making this reprocurement. We offer coverage to nearly 2 million Virginians. Our Virginia Medicaid populations. Medicaid coverage is available to Virginians who meet specific income thresholds and other eligibility criteria. This slide is a breakdown of those populations that include children, adults, and older adults, as well as pregnant, postpartum women, and limited benefit individuals. DMAS's strategy to improve Virginia's managed Medicaid program started in 2021 with a legislative directive to consolidate the 2 managed care waivers and contracts, and also with an enhanced model of care that has already been implemented and with the reprocurement. This program adds value to the Cardinal Care Managed Care program, no changes or reductions to covered benefits, same populations and services that are included, and also the same populations that were also excluded. Leverages technology, innovation, new payment models, and community partnerships. CCMC puts the member at the center, making sure all of their care needs are met for our members and that care is being coordinated as needed. It includes responsive and holistic care management, will enhance availability and access to our members, improves linkages to resources to address health-related and social needs, includes increased opportunities for members to live in their setting of their choice, promotes quality of care and quality of life, adds a new foster care specialty plan, that will focus on providing tailored and wraparound supports to address the unique physical and behavioral health needs of children and youth in foster care. The next couple of slides are our top 10 goals of Cardinal Care, and we're just going to highlight a few. To strengthen provider access, adequacy, and availability through streamlined administrative and payment processes, training, and monitoring. To support members with high-risk factors through case management and other resources to support health-related social needs in the community. Provide support to children and youth in foster care and a dedicated health plan and services to meet their behavioral and health needs. And also, lastly, to drive innovation and operational excellence with a focus on value-based payment arrangements and improved outcomes. So let's talk about what is staying the same. There are no reductions in services and benefits. Existing service authorizations issued by DMAS or the previous health plan will remain in place for at least 30 days or the length of the authorization, whichever is sooner. There is one managed care program, but providers may have to sign up to 5 contracts with the health plans. Providers will continue to be enrolled with DMAS and periodically revalidate directly through the Provider Services Solution Portal, also known as PRSS. And as it is today, newly enrolled Medicaid members will be in fee-for-service for a short time prior to enrollment into a health plan. Now let's take a look at what is changing. Humana Healthy Horizons of Virginia is CCMC's new health plan. Molina will no longer be available. Providers can start contracting with Humana now. We have a new model of care with a stronger focus on member-centered care with holistic and responsive care management. Anthem Health Keepers will serve as a single statewide foster care specialty plan for children and youth in foster care, adoption assistance members, and individuals with former foster care eligibility. There is increased availability and accessibility of care across all settings, improved network adequacy and access for members, a reduction in provider administrative burden through standard credentialing processes, more specific MCO clean claim and prompt pay requirements, additional provider training and technical assistance. There is monitoring of provider network compliance with appointment availability standards and to promptly address issues at the individual and regional level. Transitions to Humana. Molina members will be enrolled in Humana Healthy Horizons of Virginia with an effective date of July 1st, 2025, and will have 90 days from that effective date to make any changes. After this period, members will have to wait until the next open enrollment period to change their health plan. Existing service authorizations will be honored for 30 days. There will be a special CCMC enrollment period. Members will be able to compare and select a new MCO during the enrollment period between June 19th and September 30th of 2025. New plans selected before the 18th of the month will be effective the first of the new month, and new plans selected after the 18th of the month will be effective the first of the following month. CCMC members do have a choice to stay with their current plan or change plans. With CCMC, there is a responsive model of care. This model of care fosters an interdisciplinary care team, also known as an ICT, to promote member health and well-being, and also supports the member's choice to reside in the least restrictive environment and facilitate successful transitions. There are 3 different levels of care management intensity: low, moderate, and high. There is enhanced Cardinal Care Managed Care, care coordination, which is now available to all Cardinal Care members. As you can see from this diagram, the level of care coordination will be based on a member's needs, not just the type of Medicaid that members have or their diagnosis. The model is designed to adjust as an individual's needs change. The Cardinal Care Managed Care Health Plan care managers partner with you as providers to support members. Care managers will provide supports for medical and also non-medical needs. This may include health risk assessments and development of comprehensive care plans. Wraparound services will be established and will address non-medical needs, such as, example, housing and food access. Should you want to learn more about the new model of care, you can refer to the Cardinal Care Managed Care 2025 contract on our DMAS website. The information regarding the model of care starts at section 8.0. We are now going to talk about the foster care specialty plan. For Virginia's purposes, this is how each of the eligibility categories are defined. Foster care. All children in foster care are categorically eligible for Medicaid unless they are not considered Virginia residents or have income or other financial resources that make them ineligible. Former foster care under the Affordable Care Act, young people in foster care who turn 18 and age out of the system are eligible for Medicaid up to age 26. Adoption assistance. Children with special needs can be eligible for Medicaid coverage to facilitate adoptive placements and ensure permanency for youth. All eligible members will be automatically enrolled into Anthem's foster care specialty program unless the members elect to opt out. The foster care specialty plan does have value-added benefits. This population can elect to opt out, but if they do, they will lose the value-added benefits that the foster care specialty plan will provide, and a few of those are highlighted here on this slide. On this slide, there are key reminders for you as providers. We want you to note the provider enrollment phone numbers in state, out of state. There's also an email for the Virginia Medicaid provider enrollment, which is Gainwell Technologies. And also MCOs will talk more about the PRSS process. This is a great visual slide of the front and back of all the MCO member ID cards so that you can be familiar when you're working with our members. And this is also another good slide for you as providers so that you have all the information you need to contact the MCOs and know how to contract with them as well. This concludes the DMAS portion of the presentation, and now we will hear from each of the health plans.
Aetna Better Health of Virginia has a long-standing commitment to serving Medicaid members in Virginia for nearly 3 decades. We have a deep presence in the community that allows us to authentically understand the unique needs of our members and build strong relationships with provider partners. Our focus is on enhancing the health and well-being of every individual served. As our programs evolve, our core mission of achieving a healthier world stays constant because healthier happens together. Aetna is easy to do business with. Our provider relations team is dedicated to enhancing the experience for healthcare providers by ensuring quality and efficiency. We offer an online self-service portal, Availity, for managing claims and authorizations, and that streamlines processes for providers. Our Quick Pay program is particularly beneficial for safety net providers, helping to improve cash flow. Additionally, we have customized provider manuals, like for our doula providers, so they can access all of the information they need in one place. Also, our web-based training modules promote health equity and compliance. Our flexible engagement model helps to make sure that providers can focus on patient care without administrative burdens. Here's what Aetna is doing to make it easier to be part of our network. We are committed to simplifying the process for providers to join and thrive within our network. Innovative contracting strategies and value-based payment arrangements are designed to enhance quality outcomes and retain providers. Also, our AVIP model incentivizes providers based on patient health outcomes, ensuring a focus on quality care. Efficient credentialing processes, supported by technology, allow for quick verification and compliance. The use of our customized CRM tool, PEERS, enhances visibility and analytics, enabling proactive support for providers and reducing administrative challenges. What can providers do to help Aetna make sure that the changing needs of our members are met? Providers can always connect with a member's care manager via member services to report changes. Just call 1-800-279-1878. Plus, we regularly provide educational materials and samples of our kits to your offices so you know what our members are getting. We also encourage you to share our value-added benefits member guide with your patients. It's a guide that covers everything our members need to know to use their enhanced benefits, like how to get free rides, free cell phone services, and more. We also communicate these benefits to our providers in our provider newsletter. Both the value-added benefits member guide and our latest provider newsletter can be accessed on our website at aetnabetterhealth.com/Virginia. Plus, learn about different programs we offer to our members, like our Justice Involved Care program for members who were recently incarcerated, or our maternity care program, where every pregnant member is assigned a care manager up to 12 months postpartum. For our MLTSS members, these members are supported by a care team. What is your role as a provider? Your role is to communicate with care teams, members, and caregivers. Collaborate with us on the ICP, maintain ICP in the member's medical record, participate in the care team, remind the member of the importance of the HRA, encourage the member to work with their care team. We appreciate all that you do for our members. Our providers can access a wide range of resources and reference materials on our website. These include provider announcements, newsletters, notifications, our provider manual, and our quick reference guide, which is a valuable resource that contains useful phone numbers, websites, and more. And you can download and print it to display in your office. Additionally, we offer information on enhanced member and value-added benefits, as well as member rights and responsibilities. To join our network, providers must enroll in PRSS and sign an Aetna Better Health of Virginia contract. The provider enrollment process is initiated with DMAS through the PRSS Enrollment Wizard, which can be accessed at virginia.hppcloud.com. Once approved, providers can use their PRSS portal online account to revalidate enrollment, make changes to personal or business information, and check member eligibility. For any inquiries or assistance, providers can always contact us online or by calling 1-800-279-1878. Again, we appreciate all that you do for our members.
As we begin this new chapter of Cardinal Care, Anthem Health Keepers Plus wants our valued providers to know that we want to be more than just a payer. We plan to be your partner in improving the overall health of the Medicaid patients that you serve. We've developed a comprehensive approach to supporting providers and members through a focused strategy that emphasizes streamlined processes, member well-being, and provider support. Anthem is creating a healthcare environment that is efficient, responsive, and centers on the needs of both the providers and members. Anthem streamlines the credentialing process with CAQH. This simplifies onboarding and re-credentialing, allowing providers to focus more on patient care than administrative tasks. In addition, Anthem has embraced automation to apply provider demographic information from the state's PRSS provider enrollment portal. This technology-driven solution minimizes the paperwork that providers must submit when they join the network or when they need to update demographic information. Anthem also invests in quality incentives and shared savings programs designed to maximize the provider's revenues while promoting better healthcare outcomes for members. These programs are structured around the principle that prioritizing members' health benefits everyone. Anthem's provider training programs, like the Pathways program, supplement these initiatives by supplying relevant, tailored content that supports providers in delivering high-quality care. Monitoring provider billing patterns and identifying claims system issues is another area where Anthem steps in to offer support. By analyzing claims data, we generate targeted messages to educate and inform our provider billers. This year, we are introducing new tools to communicate directly and more efficiently with your billers about issues that affect their work. The result is a more informed provider base that can focus on delivering outstanding care without being bogged down by operational challenges. Anthem's focus is our whole health strategy, which emphasizes a person-centered approach to care. Anthem's specialized clinical teams, alongside strong connections with community organizations, amplify this strategy, creating an ecosystem of care that supports the well-being of children and their families. By fostering robust community partnerships and focusing on targeted population health, Anthem ensures that high-quality providers are incentivized to deliver top-notch services, highlighting the organization's dedication to excellence in care provision. Anthem provides a wide array of benefits dedicated to enhancing member experiences across various facets of life. For youth, members may receive access to resources such as books, grocery gift cards, youth club memberships, and sports physicals. These benefits aim to support the physical and mental growth of children and adolescents, ensuring that they have the necessary resources to thrive in all aspects of their lives. For employment support, we offer vouchers that cover GED testing and application fees for post-secondary education. This underscores Anthem's commitment to supporting the professional development of our members, ensuring that they have the educational qualifications needed to pursue better career opportunities. Transportation is another vital component of Anthem's member benefits program. By providing access to transportation for medical appointments, pharmacy visits, and other essential services, Anthem facilitates seamless access to necessary healthcare services. This capability ensures that members can receive timely care without the barrier of transportation, which is a persistent issue many individuals face when accessing healthcare. In the realm of technology, Anthem offers members a free cell phone with a suite of digital health apps, alongside enhanced benefits for hearing aids and 24/7 access to physicians for urgent care needs via computer, tablet, or smartphone. The integration of technology into healthcare services represents a forward-thinking approach to healthcare accessibility, ensuring that members can engage with their health providers in a manner that is convenient and accessible. We also provide a range of lifestyle benefits to support the everyday needs of our members. These benefits include personal and feminine hygiene products, home-delivered meals following hospitalization, home safety items, and assistance with obtaining identification. Such practical support services are designed to ensure that members can maintain a dignified standard of living while focusing on recovering or maintaining their health conditions.
Anthem proudly introduces our new foster care specialty plan as Virginia's trusted choice for children in foster care, adoptees, and young adults aged out of foster care. We are dedicated to partnering with you, our providers, to ensure that every child and family connected to foster care receives the highest standard of care. Anthem's foster care specialty plan significantly improves the lives of our youth by providing unique benefits tailored to the wellness needs of children and young adults in foster care. These benefits embody our commitment to nurturing a healthy environment for our members. As trusted partners, you deserve seamless and efficient support, allowing you to focus wholeheartedly on providing exceptional care. We offer dedicated support lines tailored to resolve your member-related concerns swiftly. Our specialized support team is here to assist you every step of the way, offering a seamless experience designed to meet your unique needs. Anthem Foster Care Specialty Plan is your trusted ally in fostering health. At the heart of our plan is a dedicated care management team, ensuring personalized guidance and support. They work diligently to eliminate barriers to care by helping locate in-network providers, coordinating vital medical and behavioral health visits, transportation, pharmacy needs, and much more. You're not alone in your mission to provide focused, comprehensive care to this unique group of members. Anthem is committed to enhancing your capacity to care for youth in foster care by offering specialized training on critical topics, including the effects of trauma. We are proud to support clinicians' training in evidence-based practices, Our goal is to empower you with the skills and knowledge needed to deliver care that meets the unique needs of these individuals, fortifying our partnership with shared excellence in care. We're not just a payer, we are committed to partnering with you, providing the best possible care for youth experiencing foster care. Join us in our mission to ensure that every child and family connected to foster care and adoption thrives. Visit our provider website for more information and to discover how together we can make a profound impact in the lives of these children and their families to create a brighter, healthier future.
Thank you for entrusting us as your healthcare partner. We remain dedicated to providing personalized, proactive care to promote the health and well-being of our members. Please get in touch with us for assistance or inquiries. Anthem is committed to member rights, ensuring fair treatment, privacy, and the ability of members to participate in decisions about their health care. Member rights are protected by laws, including the Americans with Disabilities Act, protecting access to safe, timely care, and the ability to update medical records or report any issues. If you experience dissatisfaction, you can file a grievance at any time with a decision communicated back to you within 90 days. Appeals against any services denials can be requested within 60 days, with expedited options available for urgent needs. You can file grievances via phone, the secure member portal, or by sending a written request. A representative can act on your behalf to ensure all concerns are handled effectively.
Humana Healthy Horizons in Virginia is the newest health plan to join the Cardinal Care program. Humana is creating a fresh brand in Medicaid by using our differentiating capabilities to enhance the provider experience. Humana has 30 years of Medicaid experience managing a variety of populations from TANF and CHIP to specialized programs such as LTSS, ABD, IDD, and duals. Humana employs over 950 Virginia-based associates, so we can be part of the community we serve and offer the benefit of dedicated local support to both our members and providers. We deploy 3 complementary provider support teams: provider relations staff, claims educators, and provider performance improvement specialists, who work with our provider community to make it as easy as possible to do business with us. Humana offers accessible tools and resources such as focused provider guides, Availity, and a population health insight tool that presents multiple levels of analytics and reporting. Additionally, we take a person-centered approach to caring for our members as we partner with our providers to integrate physical and behavioral health while also addressing members' health-related social needs. Let's dive a little deeper into how we make it easier to do business with Humana. We reduce provider burden by leveraging the MES portal to retrieve credentialing forms, eliminating any repetitive paperwork for your organization. We utilize CAQH to accelerate credentialing by digitizing the process using a single database to save time and reduce errors, and we align recredentialing dates across Medicaid and Medicare lines of business to make the process simpler. We partner with you to provide transparency and faster claims payment by publishing the first Friday of each month any new code editing rules and rationales. We offer a prior authorization search tool to assist in the discovery of verifying if one is required. Your provider relations reps will work with you to set up electronic remittance advice and electronic fund transfers so you can receive the most expedited payment option. Humana's provider services staff partners with you to provide tools and resources through our easy-to-navigate web portal, conducting provider trainings in open office hours, and meeting with you in one-on-one and group settings. Our staff is dedicated to supporting our providers and are available to help you navigate our processes and workflows. We also have staff available to collaborate in translating available data and reporting, and can assist in identifying tangible and impactful interventions that could support improved quality performance and value-based program outcomes. Humana Healthy Horizons care management model delivers a team-based, person-centered approach to managing our members, your patients, medical, social, and behavioral health needs. Our guiding principles include having a locally integrated team that supports trauma-informed and strength-based care interventions. We use a multidisciplinary care team to ensure comprehensive care for our members. Our dedicated CM teams partner with our providers to support members in their transitions by reducing admission and readmission risk, managing anticipatory transitions, reducing ED visits for non-urgent needs, reinforcing medical instructions and educating on disease processes, assessing and closing care gaps associated with health-related social needs, and discharge planning and support. In addition, our community health workers can conduct site visits to members who may be hard to reach. We have many care and disease management programs, including, but not limited to, neonatal intensive care unit case management, Humana Beginnings maternity program, behavioral health and arts care management, and chronic condition management. As a way of providing person-centered solutions, Humana offers a variety of dynamic enhanced benefits. Let's review a few of them. To support family well-being, Humana provides fresh and nutritious produce boxes to pregnant and postpartum members to promote a healthy pregnancy. Humana enhances the quality of life for members in restrictive settings through offering accessible and personalized support. Humana's enhanced services include a fall prevention kit that can reduce the risk of fall by addressing environmental hazards, and non-medical transportation that promotes well-being, maintains quality of life, and increases access. Humana offers a $65 quarterly OTC allowance, which is crafted to support members by providing access to essential care items, helping them both save money and maintain their overall well-being. Humana's preventive benefits, such as tobacco and vaping cessation and weight management coaching, are designed to enable members to take control of their health and well-being, ensuring they can lead healthier, happier lives. By working with a member's care manager, providers can help connect members to these and other enhanced benefits. Our enhanced benefits are included in the provider manual, provider orientation training, and are accessible on our website. Care managers, in collaboration with provider relations representatives, will educate providers on enhanced benefits when it is identified they are not being utilized. Providers are not required to submit an order, prescription, or request an authorization for enhanced benefits. However, providers are encouraged to educate members to contact their care manager. Humana realizes that early notification of pregnancy can reduce complications and improve birth outcomes. We offer providers the opportunity to earn a reward payment for timely notice of pregnancy submissions. Participating providers who submit 5 or more unique completed notice of pregnancy forms for members in first and second trimester will be eligible to earn a reward payment. Humana will offer a variety of additional provider incentives and value-based payment programs starting January 1st, 2026. Humana has established community partnerships and has provided funding to multiple Virginia-based organizations to support increased access, address care gaps, improve in-person support, and focus on meeting beneficiaries where they are in their healthcare journey. There are a variety of ways to contact Humana staff and to submit correspondences. Our online provider manual contains a full list of email addresses, mailing addresses, and phone and fax numbers. Full list of email addresses, mailing addresses, and phone and fax numbers. We've listed out some key contact information for you on the slide. In addition, our Humana Healthy Horizons member ID card contains key phone numbers such as member and provider services, pharmacy inquiries, transportation services, and clinical triage, so it is readily available to you whenever you see one of our members. Your assigned provider relations rep will be available to take calls, respond to emails, have virtual or in-person meetings, and it can assist you in obtaining Humana contact information. Our provider relations team has an email box, VA Medicaid Provider Relations at humana.com, that can always be leveraged to assist with any inquiries or concerns. Availability can be leveraged as well from any online transactions, such as submitting claims, pre-authorization requests, and reconsiderations, as well as to check eligibility or receive an electronic remittance advice. Humana offers access to documents and electronic remittance advice. Humana offers access to documents, forms, communications, programs, and contact info on our health plan website. Easy accessibility to prior authorization list, preferred drug list, and behavioral health resources are available. Plus, a variety of compliance training materials and resources are posted on the website. You can find a full list of services requiring prior authorization at humana.com/PAL. You have a choice of options for requesting an authorization. You can access it online by visiting the provider portal at Availability Essentials. You can call and follow the menu prompts for authorization request on the phone, or you can fax a request. Providers who care for Humana members can submit paper claims through the mail or electronically through Availability Essentials. Initial claims must be submitted within 365 days from the date of service. Corrected claims must be submitted with 180 calendar days from the date of the explanation of payment. When filing an electronic claim, providers should use payer ID 61101. To get paid faster and reduce administrative paperwork, we encourage you to sign up for electronic fund transfer and electronic remittance advice. Humana Healthy Horizons looks forward to partnering with our provider community as we serve the Medicaid beneficiaries throughout Virginia.
Since the inception of the Medicaid Managed Care program, Sentara Health Plans has served Virginians for 28 years and is the only Virginia-based managed care organization trusted by nearly 600,000 Virginians. A division of an integrated delivery network, Sentara Health Plans gathers insights from our family of physicians and facility providers. We use these insights to provide better support to our entire provider network. With a network of over 53,000 providers across Virginia, members have access to Sentara's system of hospitals, primary and specialty care clinics, and urgent care centers. Since 2022, Sentara has invested more than $770 million into communities across Virginia and continues to offer care through our Sentara Community Care Centers and mobile clinics. Sentara Health Plans offers a wide variety of supports for our provider network. Your most common interactions will likely be with our provider services team for inquiries related to member eligibility and benefits, as well as help for up to 5 claims. Beginning July 1st, our provider services line will be open extended hours from 7 a.m. to 7 p.m. We've added an extra hour on each end of the day to better serve you. Your assigned network educator is available for other needs, such as health plan updates, escalations for 10 or more claims, complex issue resolution, or contract concerns. Sentara Health Plan's partnership with Availability Essentials improves our payer-provider collaboration through reduction of administrative burdens, elimination of manual processes, and by providing access to self-service features. Our engagement opportunities include provider support visits, which are an extension of our monthly care gap closure series titled Provider Quality Care Learning Collaborative. We offer routine webinars on a variety of topics. These include new provider orientations, which are recommended for both newly contracted providers and new staff, claims clinics, and behavioral health sessions. We also offer pop-up sessions to address unique needs as they are identified. The Sentara Health Plans provider website, sentarahealthplans.com/providers, is a robust operational and educational platform that houses manuals, a variety of forms, printable self-help resources, a growing library of on-demand videos, and many important communication updates. The Sentara Health Plan's model of care is extensive, so in the interest of time, we have highlighted only a few programs. The Welcoming Baby program provides outreach, education, case management, and follow-up by maternal health professionals. And the Substance Use Disorder Pregnancy and Parenting pilot provides education to community-based organizations on substance use disorder screenings for pregnant and parenting members. In the chronic care category, we offer the Diabetes Transition Program, which is staffed by a trained diabetes management team that works one-on-one with our members. Our Diabetes and Asthma program provides support to families managing a child living with diabetes and asthma. And Sentara Health Plan's Ponos Care program provides concierge concierge-style care for members to address the physical and psychosocial aspects of chronic disease. Lastly, I'll mention 3 of our many behavioral health initiatives. Our behavioral health coaches collaborate with care managers to ensure members complete screenings and connect to prevention resources and services. Peer support specialists with lived experience support members in foster care, out-of-home child placements, the carceral system, and other traumas. And school liaisons promote health, well-being, and education within our school systems. We plan to add 16 new liaisons as the program continues. As you can see, Sentara Health Plans offers a host of enhanced benefits for our members. As this is only a partial list, we encourage you to review our Medicaid Provider Desk reference to learn more about Sentara Health Plans. It is important to ensure our members are using their benefits. Therefore, Sentara Health Plans will partner with you as a provider to ensure that you have up-to-date information on the many benefits we offer. Providers can remain abreast of our Medicaid enhanced benefits by reviewing the member's care plan as outlined in the provider portal, as well as participating in interdisciplinary care team meetings. Our care managers will contact members and providers when we note that enhanced benefits are not being used. We find that collaboration between Sentara Health Plans and providers reinforces awareness and promotes utilization. In addition, we routinely remind providers about the enhanced benefits throughout the year via website banners, email webinars, and other modes of communication. When a concern arises, you are encouraged to contact Sentara Health Plans to report a member's changing needs by calling member services and request to speak with the member's care manager or by calling the care coordination line. We have included a list of common health plan contacts. Most notably, the provider services team will be your first point of contact to verify eligibility, benefits information, and make inquiries for up to 5 claims. You should contact your assigned network educator to address special needs such as health plan updates, escalations for 10 or more claims, complex issues resolution, and contract concerns.
Welcome to the United Healthcare Community Plan Provider Education. Who we are, what is our mission and our values? Our mission is to help people live healthier lives and to make healthcare work better for everyone. Our values, integrity, compassion, inclusion, relationships, innovation, and performance are strived through our interactions every day. Our consumers, we strive to deliver simplicity to and earn their trust. Community care systems, we want to be a catalyst for a person-centered community-based health transformation. Our state partners, we want to be recognized leaders in delivering person-centered community-based health transformation. Enhanced benefits. Eligible members have access to a variety of enhanced benefits. One Pass Fitness. For members ages 18 plus, unlimited access to 300 plus gyms, premium YMCAs, and over 14,000 digital fitness options. Diaper rewards. Up to 500 diapers at no cost for attending prenatal and postpartum appointments, beginning July 1st, 2025. 6 for Kicks Plus. Up to $100 in vaccine incentives at Foot Locker and Walmart for members up to age 18. GED support for members ages 18 plus. Unlimited materials and support to complete the GED test at no cost. Menstrual supplies. Eligible members can receive menstrual underwear for free. Housing application reimbursement. Up to $80 in gift cards to reimburse housing application fees. Self-care. Mobile app for emotional health support at no cost. Doctor Chat by UHC. Live telehealth doctor visits 24/7. Weight Watchers. For members ages 18 plus, receive free vouchers. social trip transportation, up to 12 free round-trip rides to places of worship, grocery, DMV, DSS, gym, and more. Provider portal, uhcprovider.com. Save time, get better documentation, and reduce paper by using our online tools, which include resources such as self-service provider training, check eligibility and benefit information, access claims information like status updates, reconsiderations, and appeals, submit prior authorization requests, access items in document library, UHC provider chat for live support, and more. Most questions can be answered using one of our online solutions at uhcprovider.com/digital solutions. Credentialing ease with Onboard Pro. Providers can save time with Onboard Pro as it integrates with CAQH ProView, so you don't need to re-enter the same information for the United Healthcare. Requires less back and forth. The tool will let you know immediately if additional information is required. Sends immediate confirmation. Will email you a reference number shortly after your application is received. Allows you to check status 24/7. Your personal dashboard will show the real-time status of every enrollment request you've submitted. Model of care, care coordination, MLTSS. Members have a variety of ways to receive care management support by making outreach to United Healthcare Community Plan member services at 1-844-752-9434 or via our nurse line at 1-800-842-3014, or they may use the TTY line at 711, 24 hours a day, 7 days a week, to talk to an on-call nurse. Here's where they can receive assistance with health-related social needs, such as housing support, food insecurity, transportation, social isolation, and caregiver support. Network care coordination, facilitating care or DME for in-network providers. Authorization support, supporting authorization for environmental modifications needed in the home or personalized emergency response system. Provider communication. After assessment, care managers share the personalized care plan with the providers and invite to provide feedback and attend interdisciplinary care meetings. Model of care, care coordination, MLTSS. Within 3 months of becoming a UHC member, a representative will perform a screening for care management services and needs to support members in the community. Ongoing high-risk case management with monthly touch points for populations such as high-risk maternity, complex care, such as end-stage renal disease, behavioral health, and NICU. Supporting closure of gaps in care, including follow-ups with their provider or specialist. Before receiving LTSS supports and resources, a community-based or hospital team will assess members to determine if they meet the level of care criteria and need for LTSS. How we communicate with you. There are various ways to connect with us through our online resource tools at uhcprovider.com, where you can find most of your information, our annual updated administrative guide, uhcprovider.com/VA community plan. You can also enroll in our network news at uhcprovider.com/news. This is a monthly publication that alerts to changes in policies or procedures and provides updates to the administrative guide. You may also reference our reimbursement policy updates, which alerts to changes in reimbursement policies and/or procedures. Provider key contacts. Our provider key contacts Here, you will find various ways to connect with us, such as our links to our provider service teams via a live chat, provider education and training, our resource library, and provider and community portals. We have reached the end of our presentation. We want to thank you for your time and your participation.
Welcome back. As a reminder, the slide deck and recording are available on the Cardinal Care webpage for reference. Additionally, as we gather questions, please be mindful of the instructions, particularly regarding the sharing of protected health information. Now that we've had an opportunity to review the implementation in more detail, we will move on to the main event, our live Q&A session, where your specific inquiries related to this implementation will be addressed. We have gathered questions from prior submissions through the question and answer submission form. Thank you to those who contributed. Rest assured, these questions will be included in today's discussion. Any inquiries we're unable to immediately answer will be documented and answered on our frequently asked questions page, which will also be accessible on the DMAS provider Cardinal Care page. Please remember that DMAS and MCOs are dedicating this session exclusively to Cardinal Care Managed Care related questions. We will work directly with the MCOs to resolve all claims, appeals, or process-related inquiries that are not specific to CCMC. If challenges persist, you may reach out to DMAS for further assistance. Please be prepared to provide DMAS with the details regarding your resolution efforts with the MCO, including who you spoke with, their response, and any relevant details. These issues will be included in our FAQs, and we will collaborate with the MCOs to develop implementation escalation contacts for MCO-specific concerns. For claims and service authorization denials, the MCO appeal and reconsideration process must be followed. At this time, I'd like to invite representatives from each health plan to introduce themselves. Leads will unmute to facilitate introductions for themselves and their teams. So first we have Aetna and Corey Pleasance. Corey, you can unmute and introduce your team.
Thanks so much. Good morning, everyone. My name is Corey Pleasance. I am the Chief Operating Officer for Aetna Better Health of Virginia. With me on the call, I have members of my provider relations team, Mike Brown, our Director of Provider Relations, RJ Dix, and Lily Elling from our provider relations team as well. Looking forward to answering your questions today. Thanks.
Thank you, Corey and your team. Next, we have Anthem and Heather Payne.
Good morning. Thank you for allowing us to join. I'm Heather Payne. I'm with the provider data process expert with a health plan. We have Maria Richardson, Shanika Mills, Tracy Carlisle, and Alicia Richardson. I'm sorry, Alicia Reed. My apologies.
Thank you, Anthem. Next, we have Humana Healthy Horizons and Carrie Whitaker.
I was going to say, is that me? This is Carrie Whitaker. I'm our Director of Contract Compliance. I am joined today by several of our folks. Brian Duke is with our network, and Jolie Porter is with Provider Relations. I believe we also have some of our clinical folks on if we have any questions related to that. Thank you.
Thanks, Carrie. Next is Rosemarie Kidd with Centera Health Plans.
Hi, actually, Rosalind Jenkins will take the lead on that. Thank you. My name is Rosalind Jenkins. I'm the manager for provider training and education. And joining us is Rosemary Kidd, who is the manager for integrated care management, Lori Switzer, the manager for care management, Antonio Bailey, manager for customer operations, Ebony Franklin, manager for network engagement. And then we also have a huge team that's supporting us to help answer questions as well.
Thank you, Rosalind. And now we have Ryan May with United Healthcare.
Hi, I'm actually, it's Amy Mendez with United Healthcare. Hi, Ryan. I'll be introducing us all from the United Healthcare side. So I'm Amy Mendez, Director of Strategic Partnerships for the United Healthcare Virginia Health Plan. On the phone with us today, we have Ryan May, who is our Executive Director for our health plan. And I have various provider service team members, including Veronica Broby and Dale Rakes, who are our managers for the provider service teams. Thank you so much for allowing us the opportunity to be with you today.
Thank you, Amy. Lastly, I'd like to introduce our DMAS staff who will be addressing questions that are not specific to the MCOs, including those related to DMAS coverage criteria, processes, and policies. Again, my name is Michelle Watson. I'll be facilitating, and I would like to give our DMAS staff a chance to introduce.
Good morning. My name is Lynn Best, and I am a member of the Member and Provider Relations team here at DMAS. Nice to be with you all. Thank you.
Good morning, everyone. My name is Tequila Collins, and I am also a member of the Member and Provider Resolution team.
Good morning. My name is Elizabeth Smith, and I work in the Integrated Care Division at DMAS, and I work with all of the MCOs related to the Cardinal Care Managed Care program.
All right, I do believe those are all of our introductions. So we can get started with our questions. And again, we will be addressing questions that are presented both live during the Q&A panel here. So just be sure you can always access the Q&A panel and click the icon and send questions in. And we will be interspersing those with questions that were submitted during our question and answer with our question and answer submission form previously. Okay, so first question. Will all Molina Medicaid patients automatically transition to Humana Medicaid? Also, will authorizations obtained under Molina Medicaid be honored by Humana Medicaid? Or do we have to obtain new authorizations for Humana, even those that had previous authorizations from Molina for a particular service? And we'll kick this to Humana to address.
Hi, this is Carrie Whitaker. They will automatically transition to our plan as of 7/1. We will provide a 60-day, I know 30 is contractually obligation, but we will provide 60-day continuity of care and honor all existing prior auths. We've been in communication with Molina, obtaining that information, and allow members to see their existing providers for a period of 60 days, after which time we will be happy to work with our members to see if their providers would like to join our network if they are not already joined.
Thank you, Carrie. And we had quite a few questions that related to continuity of care. So
I saw that.
Yeah, that was a big one.
I was fervently typing in the
Q&A. Want to knock that one out of the park at the beginning. So thank you very much. Our next question has to do with any changes expected to impact behavioral health or ASAM programs. And I guess each of the MCOs can come up to address how you feel that it will impact behavioral health for your program. We can start.
Can you repeat that question?
Sure.
What impacts it?
Any changes expected to impact behavioral health or ASAM programs?
Okay.
The behavioral health.
Good morning. Sorry, yeah, this is Corey Pleasance from Aetna. Yeah, sorry, Corey from Aetna. I was just going to say, I would say generally speaking, with this new implementation for 7-1 go live of Cardinal Care Managed Care, we are expecting any major impacts to our behavioral health programs. I think as everyone is aware, from some of the questions in the chat, there are future plans, I believe, to potentially, reevaluate and, kind of roll out, some of the behavioral health programs. But from my understanding, at least for Aetna, we are not expecting any major impacts to 7-1 go live for our behavioral health programs.
Thank you, Corey. How about Anthem?
Hi, this is Alicia Reed, Director of Provider Network for the Behavioral Health. We are not expecting any changes at this time either. Of course, if anything changes, we will make sure to communicate and work with the providers that would be impacted, one-on-one and share some communications. But at this time, we do not anticipate any changes. Thank you.
Thank you. Humana?
It would be the same answer for us. You won't see any changes from us because we are new, new to the market. But yes, we have a very robust behavioral health program, but nothing new or, alarming or anything of that nature that would be from what you've already seen from the other MCOs.
Thank you. And United?
Hi, Amy Mendez here. We're not expecting any changes currently as well. Similar as Humana, we have a very robust behavioral health program, but not expecting any changes at this time.
Thank you. So our next question, it states our provider group is already in network, contracted with Humana and Medicaid, and per our contract, Medicare and Medicaid products are included. So do we need to do anything to add a Medicaid product when Molina moves members to Humana's Healthy Horizons?
Brian Duke, are you able to answer that for us?
Yes. So providers should contract directly with Humana prior to the end of that 60-day continuum of care period, as Carrie mentioned. We have 3 different intakes for medical providers, behavioral health providers, and ACBS providers. And I know we've listed that contact information in the chat, but we will definitely have it posted if not already.
Thank you. Our next question. When we try to add the new Humana MCO to our providers by picking Create New, Humana is not an option. Are we doing something incorrectly? Is there a different way to do it?
So that's a question I'm going to send back to DMAS. I think that on the leadership call, I believe I heard that we will be added to that very soon. So I don't think it's anything that anybody's doing wrong. I did see that question numerous times in the Q&A. So if DMAS could advise when we will be added, that would be helpful.
Yes.
Humana should be added as of June 16th.
Thank you, Adrian.
Thank you, Adrian. Yes, I was about to say we are in the process of contract. They have not been updated yet, but rest assured they've been tested and they will be available. You're welcome. Great. So we have a question. Where can we find a list of new pharmacy BIN? Yeah, I think that's going to be a question that we'll address at a later date. It's not CCMC related. Next, we've been getting lots of denials from Anthem Health Keepers for modifiers for, that's another claims question. Again, any of the claims related questions that are specific to claims and policies that's not CCMC related, we will be following up on those. So we just need to try to triage some of those for you. Our next question is, what is the cutoff for claim submissions for Molina? Should claims with dates of service prior to 7/1/2025 still be sent to Molina? We have an answer here that says claims for Molina members with dates of service prior to July 1st, 2025 should be submitted to Molina within the current timely filing requirements. see. And I think that answers that completely. We have a question here. It says for Aetna, when will we be able to, it's another service authorization question. Again, thank you for those questions. We understand that there are a lot of claims and authorization related questions that you have. Just keep in mind that we are here to specifically answer questions related to CCMC implementation. All right, our next question. We are an out-of-state long-term care pharmacy that is licensed by the Board of Pharmacy in Virginia and validated to provide to Medicaid beneficiaries in skilled nursing facilities in Virginia. We have served Molina beneficiaries, and when I contacted the Humana email provided, I was directed to Humana's pharmacy home state, not Virginia. After that, they were directed to pharmacy contract requests at Humana and submitted an email, but did not receive a response. Is this email that Humana provided able to assist with the contracting in this instance? And that email was pharmacy contract request at humana.com.
Brian Duke, I'm going to send that question over to you if you have a different email address or anything of that nature.
Hey, Carrie, this is Paula. I can take this one.
Okay, Paula.
Hey,
That would be
yeah,
great.
so I responded to this one in the chat. I would like to take this one offline. I sent an email address. I would love if Kathy could email me personally so I can get to the bottom of this, check on her inquiry to join the network and follow up with her specifically.
Thank you. So we have the question for Aetna. I will say this question. When will we be able to submit service authorization requests via Ability?
Good morning. Yeah, so we actually currently offer that capability for most providers. We do have some providers such as behavioral health providers and certain LTSS providers that aren't able to use it just due to additional forms required. But for the most part, we most providers are able to currently submit service authorization requests via Availity. So if there's anyone that has any particular questions about a provider type, feel free to reach out. We've got a provider enrollment form, provider information request form that I can drop in the chat if there are any specific provider type questions.
Thank you. So we have the question here, when a provider is re-enrolled through PRSS or re-credentialed, what is the process with each MCO regarding credentialing? So we do have credentialing requirements for each MCO available on their websites. When a provider is re-enrolled through PRSS, they do, of course, have to come through our provider enrollment wizard. And once that is completed, then the credentialing with the MCO should start. So you should also always re-enroll with PRSS so that you can be screened prior to the credentialing with the MCOs. And each MCO has their own credentialing requirements that are listed on their website. Next, we have, if we bill daily, are the claims processed daily or will they be held in queue until the end of the week? And we'll let each plan answer that. We'll start with Aetna.
Can you repeat the question?
Yes. If we bill daily, are the claims processed daily or will they be held in queue until the end of the week? Are we able to answer that question, Aetna?
Hey, sorry, I could not get my chat to come off of mute. So I apologize. So we currently have a system in place where we have check runs 3 times a week. We are implementing what we call a quick pay program for certain safety net provider types such as FQHCs. which will result in daily runs. Right now that it's specific to a certain provider type, but currently we do process claims and pay. We have check runs 3 times a week.
Thank you, Edna. Anthem?
So we have our check runs twice a week. So it's fine if you bill daily. It's just that you will receive your reimbursement twice a week.
Thank you. Humana?
Yes, I just verified with our CFO. We do process them daily.
Thank you, Humana. Centera?
Hi, good morning. We do process daily.
Thank you. United?
Hi. We do process daily, and typically, if we're submitted on a daily basis, we reevaluate on a 7-day for reimbursement and approvals. But we do process daily.
Thank you. We'll move on to the next question. We have been enrolled with Aetna, United Healthcare, Anthem, and Centera for Cardinal Care. Do we have to re-enroll for CCMC? We can start with Aetna.
Yep, no. So if you are currently an in-network provider for Aetna Better Health of Virginia, you do not have to do anything different for the 7/1 go live of CCMC.
And I guess I can just say United.
Hello. Yep. No, you do not have to re-enroll. You're already a current network provider. So.
Thank you.
Mm-hmm.
Anthem.
I mimic the other MCOs. You do not have to re-enroll if you're a current provider.
Thank you. And Centera.
Yes, the same applies for us as well. You do not need to re-enroll if you are already in network.
Thank you. I have a question for Anthem. It states, I put in a request to become contracted with Anthem as an occupational therapist. I was told that Anthem in Virginia is being reevaluated for therapy services. What exactly does that mean?
I'm not sure what that means. I've not seen that verbiage, but we do have a network manager who is responsible for contracting those types of providers in Virginia. And I can share her information in whatever way you want me to do that. I can give it to you now, or we can follow up.
Thank you. We will take that back and we will follow up with that and address it more specifically in the Q&As.
Okay, thank you.
Thank you. So for clients with dual enrollment, is there a way to prevent claims from being denied through Medicare first and then paid through Medicaid? This disrupts our ability to stay in sync with our biweekly payroll. Do we have?
Good afternoon. Good afternoon. Sure. This is Elizabeth Smith. Typically, many of the MCOs, when they have a member who's enrolled with them for their Medicare through the dual special needs plan, as well as their Medicaid, then the claims when they come in often get processed through the Medicare benefit first. And then if it's a Medicare non-covered service, or if it's denied by Medicare, but specifically for services that are not covered by Medicare, then it gets sent to the processing system for adjudication under Medicaid. This typically doesn't take very long, and the MCOs are still required to meet the contractual claims timely processing requirements in the Cardinal Care Managed Care contract for those Medicare non-covered services when they go through the Medicare first.
Thank you. I have a question. Can this MCO plan clarify whether there is any remaining patient balance If so, is it possible to bill Virginia Medicaid as a secondary payer? If not, is it communicated to members that Virginia Medicaid does not serve as a secondary payer for balances left over by MCO plans? We do have a statement here that says Medicaid payments are payments in full and there is no remaining patient balance for Medicaid covered services unless a member has a patient pay liability for long-term services and supports as determined by the local Department of Social Services. This includes payments by all MCOs for Medicaid covered services. Our next question, and this goes out to all MCOs. Can we find a way to stop dropping providers that have been credentialed for years? We go from receiving payments to being told that a particular provider is not par when we call for prior auth or file another claim. This sometimes requires a recredentialing process, and the provider states that they have not missed the recredentialing request and they have verified enrollment. So we want to address the issue with providers possibly being dropped that have been credentialed. We can start with Aetna. And if you can't answer exact now, maybe you can provide some sort of resource for the provider for this issue.
Sure. So thanks so much for the question. I actually, wrote this one down to take back to the team. Clearly, if a provider is credentialed and par in our network, we should have them reflected as such in our system. So, when these things happen, it's potentially a systems issue, but we are happy to take that feedback and, we'll definitely look into it. Again, if that happens, it's typically an error. And so we would encourage folks to reach out to, their assigned network relations manager. And if you don't know who your network relations manager is, we actually have an email, Aetna Better Health Virginia Provider Relations @aetna.com. And I'm happy to drop that, in the chat as well. But definitely taking this feedback.
Thank you. Anthem?
We would also need to have a little bit more specific information about that. We certainly should not be dropping providers from our files if the provider's been credentialed, reattested, and has enrolled appropriately. So we would need specific examples of when that happened to be able to determine what the issue was and resolve it.
Thank you. Humana?
I don't think we have any instances of that since we are new, but Brian, have you ever experienced that or have any input, or Paula?
No, I think obviously similar to the other MCOs, I mean, it's probably very situational dependent, and, recommendation would be reach out to the plan to have that discussion.
Thank you. Centera?
Yes, that is not an issue that we are currently aware of, but you can reach out to us directly, and we will be able to research that and assist you from there.
Thank you, Centera. And United?
Yeah, similar to the other MCOs, that's a case-by-case basis. I will also say we have separate credentialing processes, especially for like our behavioral health areas. And we do follow a 3-year cycle to ensure that healthcare providers continue to meet quality and compliance standards. I would also say in similar nature, when those situations happen, it's best to make outreach to your network contacts, as well as I'm going to go ahead and put in the chat some information on our credentialing process to see if that helps, as well as what some of our contact information is for our health plan.
Thank you. And I do apologize. We're getting questions live. And so a lot of the questions, I get into the middle of the question, I realize it's a claims question or it's an appeals question. So I apologize again, also to the plans. I'll try to triage these. I do have one here. Will anyone be able to have Humana Medicaid It is not just for military families. I think there's some communication that they think it's just for military families.
No, we don't have any restrictions that it's just for military families. Anybody that's eligible for regular Virginia Medicaid, as determined by DSS, would be able to enroll in Humana MCO.
Thank you, Humana. And this is also
Sure.
for you. Another question. How do we access a fee schedule?
Paula or Brian or anybody, I don't have, or Jolie actually may know that answer.
Hey, I can take this one, Carrie. So I would recommend, yeah, sure. I would recommend that you reach out to your contract manager. Your contract manager will be able to review your reimbursement and point you to the fee schedule based on your contract.
Thank you for that. We have another question for Humana. Will Humana honor the member's Medicaid number, or will we need the unique member ID number for claim processing?
We should be able to pull it via their Medicaid ID number. We do have an internal number that we use as well, but we will be able to pull it by the Medicaid ID number.
Thank you. This
Sure.
next question is for Centera. Will some Centera health plan members still be enrolled with Kaiser Permanente after July 1st, 2025?
Yes, ma'am. Kaiser will fully manage the assigned members after 7/1, and we can connect you with your network educator so that they can get in contact with a Kaiser representative.
Thank you. The next question has to do with the contracting process for targeted case management for brain injury services. I think we're going to skip that one.
Can I talk?
Yes, please, Lynn.
Hi, everyone. This is Lynn Fast, and I think it would be a really great time for Humana if you have any upcoming educational sessions for providers that you could maybe drop in the chat, or anything where they know that they can know how to credential with you, how to file claims, all the questions that we're having.
Sure.
I think that would be really, really helpful for them.
Agreed. Jolie, I know you have several provider trainings. If you could drop some information in the chat or speak to that, that would be wonderful.
Yes, sure. I'll drop the link on our website that has the provider training calendar, but we are offering weekly virtual provider orientation training sessions through June and July. So I will put that link out here for everyone.
Also, the request came in for MCOs to please provide contact information for their provider liaison, network education managers, network relations managers, provider relations account managers, or other specific entities that can assist. So we can get that information. We can probably drop that and give that to everyone as well, that list for every MCO, so they'll have those contacts.
And how would you like to provide us with that? And how should we provide that to you?
I guess each MCO can drop that in the chat, or do we have that in all of that information in one of the presentations? Yes, we'll make sure we get that and include that in the FAQ documents as well.
Okay, wonderful. If I can ask the Humana team to please populate your info in there and your email address, then they can gather a list and disseminate that to the larger group.
Thank you.
One more thing to add, we do have an MCO directory by region, and I think, if we may be able to update that with Humana's information. It's not updated at this very moment, but we can certainly do that. And I know on our slides that we have a lot of good contact information for each of the health plans. So I know that those are the most up-to-date, especially for Humana and the rest of the plans too. So don't hesitate. And I do want to say, once you reach out to the the contacts that we provided on the slide deck and what you see that is put in there in the chat, please do, we have a CCC Plus mailbox. We always want you to reach out to the health plans first with all this great information and great contacts. But we also have a team that will assist you if you need escalation. So we speak to many of you and we will certainly assist you get connected should there be issues. So, thank you.
Thank you, Lynn. I appreciate that. And I am not a selfish facilitator. So if there's anyone, DMAS staff, that has an answer that I'm not able to provide, please chime in with that information. I'll appreciate it. We can get all of the information and all of the contacts available for our providers to assist them with their issues. Does appear to be a lot of claims and related issues. So we're going to try to triage and get more relevant CCMC, but again, it's live, so we're trying to triage for you. Thank you. So I want to make sure, because someone looks like they're asking a clarifying question, so I don't want to gloss over. It's for Humana. Before it was stated that Humana will have a 60-day continuity of care, I assume that's what COC means, for prior auths. This time it just stated existing auths will be honored for 30 days. So is it 30 or 60?
No, it is 60.
Thank you.
Sure.
Also for Virginia, we don't know yet if we need to do auths for the MHCM and the SACM. I guess that's mental health case management, service authorization case management. I'm making an assumption. A majority of the other MCOs don't require.
Who is that question directed to? Just everybody, or?
Right. So the second part of that question, it does not state. So I'm going to start with Humana, but I'm also going to let the other MCOs answer as well, because that second part did not say specifically. So is it Humana?
I would have to take that offline because that I am not. Well, actually, Cecilia, you may know. Do you have any idea on that? We have someone from clinical on.
I am not sure about that. That's what I was following up right now, actually.
Okay. If we can find that answer and pop that in the chat, that would be helpful.
And if that is a clinical question, again, we will follow. Please rest assured, we will follow up each part of these questions that we're not able to answer. We will have that available in the frequently asked questions. So as we're triaging these, we understand part of the question may be relevant, another part may not. And if it's not something we can answer this time, we will have that for you at a later date. So the next question, and this is going to go out to all of our managed care partners. Due to this new implementation as a current participating provider with all health plans, are there any additional steps or requirements we need to fulfill at this time? Is there anything else additional you suggest that they can do? Aetna.
Yep, nothing required for Aetna.
Thank you. Anthem.
Nothing is required for Anthem. Thank you.
Humana.
Nothing is required, but if you are not already participating with us and would like to be, we would welcome you and encourage you to apply with us.
Centera.
Nothing will change. It should be a seamless transition for you.
And United.
Nothing will change. And I also encourage, if you're interested in joining our network, to please reach out to us and have that discussion.
Thank you. For Humana, we have a participant that wants to know how they are able to receive a provider rep, since they, of course, are new to Humana and all their products and they're waiting on credentialing. Is there a provider?
Sure. Jolie, can you answer that, please?
Yes, so I think that's probably a two-part question. So if they are asking where they are in their credentialing, they can reach out to the contractor that they've been working with. We do have provider reps. We have them in each of the 6 regions, and they are posted on our website. And I can drop the website location into the chat if you'd like.
Thank you. So I have a question here. Well, that was just X'd out. I have a question for Humana. Is Humana honoring the DMAS CMHRS or authorization request forms when submitted for new authorizations via fax? Or do we need to submit all auths on availability only?
Cecilia, do you know that one? I mean, I know that we're going to honor them for 60 days with the transition, but Cecilia, you may have more information on that.
Yeah, that was my understanding as well, on that.
So we will honor any existing for 60 days.
Yes, for 60 days.
Thank you. I have another question for Humana. Can we check eligibility with effective date 7/1/25 and availability Humana on members transferring from Molina? I tried a few days ago and no member found.
We do use availability for eligibility. I am not sure that that would show up yet because they still are Molina members and we don't actually get, they're not going to be assigned to us until effective 7/1. DMAS, do you have any other information on that?
Sure, this is Elizabeth Smith. That assignment in the eligibility system will happen on June 19th. So after that time, those members will be assigned to Humana.
So after we get our 834. Okay.
Thank you. So I have a question here. Is June 19th through September 30th the only open enrollment for members, or will there be another period later? Typically, our region is December through February. Open enrollment that starts in June, that is for all Medicaid members, correct?
Good morning. Yes, the special open enrollment period that opens in June will be for all Medicaid members who are enrolled in managed care, so that everyone will have the opportunity to look at the new plans, the new enhanced benefits, and confirm or change the plan that they'd like to be in. If a member does not take action, they'll remain in the plan that they're in as of July 1. After that, we'll default back to the standard annual enrollment process, which will be aligned and based on region.
Thank you.
Hey, if I may, it's Ryan with United. Follow-up question on that. May need to come back to that is really getting crisp around the start date for the resumption of the following regional open enrollment periods. I get the sentiment that's coming from the question here. Southwest Roanoke historically enjoyed the December to February time. Their open enrollment, being it's statewide June to September. Question then becomes, what about those regions a year out from that when that survey comes? But they're not scheduled to have another open enrollment in December of 2026. I think we need to maybe spend some time offline.
Excuse me, we're having a difficult time hearing you. Could you go in closer to the mic or speak a little louder, please? Thank you.
Hey, it's Ryan. Sorry about that. I'll try it again off of the Bluetooth. Is that better?
Yes, thank you.
Okay, awesome. Yeah, I think the sentiment I'm following is from the question there from the Southwest or even the Roanoke regions. You know, historically they're in that December to February timeframe. We really, I think, need to spend some time understanding the exact start date for when we get into January of 26, right? Which region will be going live and when? I think is a question we continue to hear in the community. So I think it might have been Sarah who responded for DMAS. Happy to connect with you offline and share some more context there. Thank you.
Thank you. Okay, now we're moving on to the next question. This is for Humana. Humana, what is your DSNP protocol?
Can you be a little more specific on that? That's kind of a vague question.
Okay, we'll take that one back.
Yeah, I'm just not sure in what context.
All right, we'll try this next question for Humana. You're very popular today. Are the forms available for enrollment on the Humana website? If a provider is already enrolled with Humana Medicare and or Humana PPO, do we still need to enroll with Medicaid?
They would still need to enroll with Medicaid. Brian, is that correct? And Paula?
That is correct.
Okay. And are the forms available online to enroll?
The forms themselves are not online, but the contact information to initiate the requests are.
Thank you.
Thank you. And I'm attempting to triage because quite a few of the questions here have been answered. Let's see. A lot of the questions are requesting forms and contact information. For all of those questions, we do acknowledge those and we will make that information available to you. So anyone that has asked for a form or a contact list or someone as a resource, we will be gathering that and providing that to you for each of our plans. We have a question for United Healthcare. Do you plan to start accepting new LTSS providers anytime soon? United?
Yes, hi. Sorry, I couldn't get myself off mute. So we are consistently looking at our network. The answer to that is we're evaluating it. And we could probably provide further information on the chat on how to do so.
Thank you. Thank you for that response.
Absolutely.
We have a question here. Contracting documents were completed with Humana directly. Do we need to do anything through PRSS enrollment for Humana to set up appropriately for contracting? My contracting is complete through PRSS and all of the other MCOs. So if you are currently enrolled in PRSS, you do not need to re-enroll. Once you are credentialed with Humana and that is completed, they will contact PRSS and let us know that the credentialing has been completed with the MCO. So if you're already enrolled in PRSS and been screened and approved, you only need to reach out and complete contracting with the MCO. This is another request for point of contact, so we will be providing that information. We've already stated, we have a question here about offering virtual sessions with Humana Healthy Horizons. Be offering any virtual sessions or provider education regarding their authorization process, specifically related to portal access, submission workflows, and processing timelines. I'd like to ensure our teams are properly educated on how this will function for hospital outpatient services, including chemotherapy, infusion treatments, and procedures as we prepare for July 1st. Any upcoming training or resources will be greatly appreciated. So we did again stipulate that we will have the any trainings that the MCOs can provide. We will give you that contact information. Are there any virtual sessions? Do any of the MCOs provide virtual training sessions to your providers? We can start with, well, the question went to specifically to Humana. We can start with Humana and then ask the other MCOs if they have virtual training sessions available. Humana?
And Jolie, I'm going to defer to you for that.
Yes, Humana has weekly training sessions available. And I did put into the chat the link to be able to register for those.
Okay, Aetna?
Yes, we do offer virtual training sessions and onboarding sessions for new providers and existing providers.
Thank you, Aetna. Anthem?
Yes, we have monthly webinars for existing providers as well as new providers.
And Centera?
Yes, we have a variety of virtual training sessions offered at various cadences throughout the year. And I can share the link in the chat or wherever you'd like.
Thank you, Centera. And United?
Yes, we actually have virtual sessions that we host, as well as one-on-one educational sessions with providers if they'd like to join us as well in a more private setting to discuss personal needs.
Thank you, United. And again, we will attempt to provide the links to any of the virtual sessions along with other training materials that the managed care organizations have available for providers. So we have a question here. They state, I believe Centera and United Healthcare has internal crossover claim processes. What is the process for other payers for Medicaid members that have other payer plans? First, I want to ask, is this Aetna and Anthem, Humana, Centera, United, is this a question that you'll be able to answer at this time, or should we refer this later for our claims?
I think it would be later for claims for us.
Thank you.
Yep.
Agreed. Later for claims.
Thank you.
Thank you.
I think for United, we put some information out in the chat, but we can also circle back later if additional information is needed.
Thank you very much. I have another question for Humana. What transportation provider is Humana using for non-emergency medical transportation?
Sure. We use Motive Care for our NEMT transportation.
Thank you, Humana.
Sure.
We have another question. There's a concern about possible backlog for the credentialing process. Do you have a time frame for your credentialing process to date? Their concern is that the credentialing will not be completed within 60 days.
Is that directed to Humana?
Yes, thank you.
Oh, okay. Yes. So normally it is 60 days, but Brian, I believe you advised any contracts that are signed prior to August 1st, we will backdate those to 7/1.
Correct.
Okay.
And we're currently averaging 30 days and less for credentialing.
Thank you. Now I have a question that it can be directed to behavioral health. For behavioral health, will we be faxing the SRA forms? For example, for TDT or IIH to Humana as we do for some of the other MCOs?
I am not sure that I have a BH person on. Cecilia, can we follow up with Jessica on that?
Yes, we can.
Thank you. So here's a question, and this is specifically for Anthem and Aetna. Will you be accepting new providers in the Tidewater area of Virginia for behavioral health services as of 7/1/2025, such as intensive in-home and MHSS? I was previously advised that they were not accepting new providers due to oversaturation of providers in this particular area. Anthem.
Hey, yes, so we will definitely be reviewing the applications on a case-by-case basis. That was what we were doing in the past, but due to this carbon, we will certainly review and consider new applications that are coming in.
Thank you. And Corey, Aetna?
Sure. Yeah. So we're always reviewing applications. We aren't currently, as a result of the 7/1 implementation, reevaluating opening, the network for these particular services in Tidewater or Northern Virginia. We will, reevaluate after the next phase of behavioral health redesign takes place to see, what gaps we may have in our network, if any, but not at this time.
Thank you, Corey. The next question, can NCOs provide assurance that its IT teams have thoroughly tested systems to ensure there will be no disruption to claims processing or provider payments after July 1st? We could start with Aetna.
Sure. So we don't anticipate any major changes taking place for us. Our systems are currently functioning and running properly. We do constant triage of our claims payment systems and service authorization systems. So we are very confident and good to go for 7/1 and beyond.
Thank you, Corey. Anthem.
I'm sorry, I missed the beginning of your question. Could you repeat that, please?
I sure can. Can you provide assurance that your IT teams have thoroughly tested systems to ensure there will be no disruption to claims processing or provider payments after July 1st?
We're definitely conducting all of the testing that is possible, and we don't anticipate any systemic problems. Like they said before, everything is planned to go according to the implementation schedule. But if anything does arise, if there's anything that you see that's out of the ordinary, we encourage you to reach out to your points of contact, to your provider representatives, to let them know that there's something that that you're not expecting to see. But no, we don't expect any negative impacts.
Okay. Centera.
Centera does not anticipate any problems effective July 1st. Okay. And no changes.
Thank you. United.
We are continuously testing our systems and have been preparing for go live now for quite some time. So we do not anticipate any disruption or delays.
Thank you. And I feel like I may have missed the health plan. Did I miss someone?
You missed Humana. We have
Okay.
been testing daily with DMAS and testing all of our systems and sending test files. And we will also, since we are new, have a command center set up for day one. So if there's any issues that arise, we will be able to immediately address those.
Thank you. Was that you, Karen?
Yes, it was.
And who else did I skip? The next question, and this is also for Humana, will the waivers that are currently in place with Molina for skilled nursing facilities automatically roll over to Humana?
They should, within our 60-day continuity of care.
Thank you. This question, and that's, I think we've talked about ability, but I'm not sure if this is a different scenario. On the ability Humana payer space, the authorization tab is for management of an already submitted authorization only. It does not seem to allow for a new authorization. How do we submit a new authorization?
I would say that's because we're not live yet, but we will, like I said, be honoring all existing authorizations for 60 days.
Thank you. This next one's Humana as well. I had a memo from Humana and the HHA exchange stating that we would have to bill through HHAX. We have another EVV. Is this a must, or can we bill through our usual clearinghouse? Having to bill different clearinghouses is kind of a headache.
That is also going to be a claims question. Is anybody able to speak to that from Humana?
I can speak to it.
Great.
So what you can still utilize your EVV vendor. We'll just need to get you to register with HHAX so that we can have the electronic data exchange between your current vendor and HHAX. And you can email our mailbox at VA Medicaid Provider Relations at humana.com if you need any more support on how to register, so that we can work with you to get that access set up.
Thank you. So we have a question here. Is there another way to complete credentialing besides ability for Anthem? So this is specific to Anthem. The site is not allowing me to move past certain areas, and ability told me to call Anthem. Anthem asked to call ability. So they're having problems credentialing. So the question is there another way besides ability? And then if not, I guess we can have a contact for someone that they can.
Yep, absolutely. That was going to be my suggestion. I can drop our email address in here, and we can work on that directly so that we can help them go through the ability process appropriately.
I'm just trying to get through. There are quite a few claims questions.
Michelle, we have one question that Elizabeth would like to answer on the field. To do it. Okay, we have a question. Is there a run out period for Molina processing claims? Will Molina maintain processing claims with dates of service prior to July 1st, or will outstanding claims be transferred to Humana? So Elizabeth, did you want to?
Sure, thanks. And there was also another question about what is the expectation for Molina in regards to finishing business, and they're waiting for resolution on claims issues that they've not yet received a response. So I just want to assure everybody that Molina is continuing to process claims and do business. They will, even after June 30th, be processing claims for dates of service prior to July 1st. They will still have staff that are working and finishing up all Virginia business. If there is a provider who is continuing to have an issue, and like with claims or whatever, and they're unable to get that resolved, then they can always reach out to the CCC Plus mailbox, and we can assist with resolution of that. But Molina will be continuing to finish up all Virginia Medicaid specific business even after July 1st. So I just wanted to reassure everybody of that.
Thanks, Elizabeth.
Thank you. I do have another question for Humana. They want to know about different options for verifying credentialing effective dates instead of calling in. My experience in other states is that there is a language accent barrier when trying to get this information. So are there other options, Humana, for verifying credentialing effective dates instead of calling in?
Hi, this is Paula. I did respond to that one. Yeah, there is another option. I provided the email addresses to our contracting team.
Thank you. Where was that email provided?
Oh, I responded to the Q&A question. So we have email addresses to each contracting team specific to the provider type, and I dropped those in the comment to that specific question.
Okay. Thank you. Okay, and now I have a question for each of the plans. They want to know, will these plans have dental benefits? We can start with Aetna.
Sure. So dental is currently carved out through the Cardinal Care Smiles program. So we do work with and collaborate with the department's dental benefits administrator to ensure continuity of care, any follow-up wraparound services necessary for dental benefits.
Thank you, Aetna. Anthem. You can unmute and answer the question.
Just we're looking like we're getting close to time, so to respect that for everyone, I think I can just give a blanket answer for that one. Across the board, the dental benefits are administered by DentaQuest through the Cardinal Care Smiles program. All of our MCOs do coordinate with them, and DentaQuest does also have a lot of member-facing resources and provide assistance with network search tools and stuff, and those can all be linked to through the dental benefits page on the DMAS site. And if folks need specific other resources, feel free to reach out to us directly. Just wanted to kind of respect time and give that blanket answer because I believe it applies across the board to all 5 of our MCO partners.
Thank you. Thank you, Sierra. And thanks to all of the participants and attendees who joined today's training. We're at the top of the hour, so we're going to wrap up our session. We truly appreciate your time and engagement as we navigate these important updates together. If you still have questions, the virtual Q&A submission form remains open for submissions. Additionally, all presentation, recordings, and FAQs gathered during our session will be available on the Provider Cardinal Care page for your reference. Again, thank you for your participation. We value your contributions and look forward to continuing this collaboration. Thank you.